This training video, designed especially for Mohs surgeons, is going to teach you what you need to know to successfully use OCT to guide Mohs surgery. OCT allows you to see the extent of the tumour beneath the surface of the skin and therefore map the surgical margins prior to surgery. The video is split into two parts. The first part will take you through the OCT mapping procedure, which is a very simple and easy to master 4-step process that's seen here on the left. To start, there will be a quick concept overview by Dr. Julia Welzel, Head of Dermatology at Augsburg Hospital in Germany, which sees approximately 1,000 Mohs patients per year. We will then go on to see each of the 4 steps of the technique in detail with Dr. Sandra Schuh, also from Augsburg Hospital. In part 2 of the video, we will have a look at some introductory training on image interpretation. This will help teach you what to look for and how to understand the images. The second patient is particularly interesting, as it shows how OCT is used when tumour reoccurs after previous surgery. Firstly though, let's move on to part 1 and learn the technique. Remember, feel free to pause the video at any time, use the left arrow key to jump back 5 seconds, and also the chapter markers in the video description below to jump between different sections.
So it's easy to demonstrate how we do this. We have here a patient where we did this procedure, and you see here the silver pencil which we use for marking the lateral margin, and if you scan with OCT over this causes a shadow in the image, and if you see something outside the margin, some BCC parts in the OCT scan, then we put another additional margin of another 2 millimeters and scan again until the outermost margin is clear from BCC.
So, thank you to Dr. Welzel for that introduction. We will now move on to Dr. Schuh, who will teach us the 4-step process in detail. Please note though, whilst there will be some image interpretation in this section, most will come in the second part of the video. Is that a standard 2mm margin?
Yes, because you see here, right over here, there's still tumor, like this big nodule here or this big nodule here, and then you have to measure from this point where it's still fine tumor, and here you see the last nodule, and then you have 2 millimeters. See, this is the safety distance.
Okay, so 2 millimeters from.
Yeah, 2 to 3.
Okay.
Yes.
From the edge of the tumor.
Exactly, 2 to 3. And this is how I did it on all sides. And you have to start making the dots from the last point of the tumor, and then you add the safety distance. Yeah, now see, it's in the center. Ohne. I have it here in my hand, and then I adapt it like this or also like this to hold it still.
Okay, so the fingers are kind of against the skin.
Yes, because I'm always a little bit shaky, you know. There are some people who have very still hands, but I always like to do it like this or even like that, you know, to cover it, like really to hold it firm. We start with the measuring of the margins at 12 o'clock, then we go down to 3 o'clock, and then to 6, and then to 9 o'clock. And we measure all the margins and slightly overlapping. Okay, let's see. You need to position the probe exactly in the middle. Our demarcation should be in the center of the image, and on the left side there should be still the tumor, and on the right side there should be healthy skin if you have done something right. Therefore you need the color camera in the vivo side to really position the probe. And here we can see my demarcation very sharply, hyper-reflecting, and here we have the shadow of this demarcation. And in this image on the left side, we have the tumor, we can see here, and this should be healthy skin. And we can see the tiny nodules here, and also here, and here. It's, I think, a micronodular cystic subtype here also, but we can still see some nodules on the right hand, which should be healthy skin too, because we can see a lesion here and also here, and this is why I decided, and also here, this is why I decided I want to add a safety margin to cut the BCC, hopefully tumor free. Now we add 2 to 3 millimeters again of a safety distance.
Okay. Because you've seen some tumours in the
Yes,
image.
I've still seen some parts of nodules.
Okay, so you've put a dot 2 to 3 millimeters.
Yes.
And then scan again.
And for me, it's necessary to assess it again. Yes, okay. And then I draw the line. And then we move around, position the probe again. Können Sie den Kopf ein ganz wenig nach links? Genau, sehr gut. And now you really have to pressure it again on the white line, and there we also see some nodules. Okay. I can show you where the nodule is. You can see here. This is still some residual BCC tumor, and it's not inside the line. Here is the line.
The line is over there. Okay, that's
Here's
the shadow in the image.
Yes, this is the rest of the tumor, and this is the healthy tissue, but it's not healthy. Here you can see a nodule again.
Okay.
On to 6 o'clock.
Okay.
Okay.
So for the 3 o'clock margin, you've corrected it again.
Yes, I've corrected it again. We can also check if it's okay now. But normally I do it clock around and then I start again. Because there I still see some more tumor, okay? Okay, then we need to position it like this.
So is there a technique to moving it around? Do you have to stretch the skin, or how
no,
much pressure do you put?
not stretch the skin. It's just looking at the color camera and really do the positioning in the center. This is very necessary because you need to know where is the tumor part and where is the healthy part. And here we also see some tiny nodules, but not so much.
Okay.
Like we did before. And then we start again.
So the technique is really to, instead of sliding it over the skin, you pick it up and place it back down on the skin,
Yes.
but overlapping.
By overlapping. Now we measure again. Okay, we place it again at 12 o'clock. We see the sign. And now it's clear. Okay, so we're fine.
Okay.
Then we place it again on the skin. We check for a safety margin again. On the margin.
So essentially, once you've extended the margin,
I check
you
again.
You do a final check.
Yes,
Just
I
make
do.
Sure.
Just to make sure if it's okay. Perfect. We have the tissue here, free. Here, still tumor. And then we move around.
So the healthy tissue is always on the right-hand side.
For me, I do it like this. You can also do it on the other side. But
Okay.
for me, I'm a right-handed person,
Okay.
so I do it like this, you know. And now I think the tumor is clear. I was done with the surgery.
In this part of the video, we will have a look at some image interpretation. Patient 1 is the patient we've just seen being scanned, and patient 2 is a different patient who has a reoccurring tumour in and around a scar after having surgery at an earlier date. Dr. Xu is using OCT to map the border of the tumour, some of which is hidden by scar tissue.
It was in the center, or nearly in the center next to the crust, to determine the subtype and also the tumor thickness, and to get an impression of how this special tumor looks like. And if we scroll here, we can see also a cystic part over here, and we can also imagine that there might be something going on. If we scroll around, we can see the dark rim again and the tumor cyst. I did some measurements of the tumor thickness. I think it's slightly bigger than 1 millimeter, because here there is no real demarcation of the tumor, but I think it's clinically and also macroscopically bigger. And if we follow it, then we can here see this dark line, and also the nodules. And also here, the nodule. And then we started scanning clockwise. And this is went at 3 o'clock, or in between 12 and 3 o'clock. And here we have the same procedure. This is the typical demarcation of the pen. We can see some tumor nodules here, but we can also see some structures maybe here, and this is why I also added a safety margin. Here we have the same procedure. This is the demarcation of the pen. This is inside the tumor with some nests here and here. And this is outside, and we can still see some structure over here And this is why he decided I will go on and add a few millimeters safety margin. Okay. This was already the correction of the safety margin. Here you can see the first drawing of the pen, and this is the second line. And you can see this is the big shadow of the second line. And inside, right on the left side, you can see the tumor nodules. So it was right to add a few millimeters to the safety margin. And in this area, there is no typical structure of the basic cell carcinoma. You can see just some blood vessels here. This is all right.
Okay, so that means that you don't need to draw any more safety margins after that.
So 2 were enough at this point.
Okay.
This one is very big. This line was very big, which I draw. This is also the second line. Here you can see the first line. And here is the demarcation of the pen of the big line. And if we see these structures, this right side, which should be healthy skin, then, well, it is healthy because we don't see any typical features of basic carcinomas. No big cysts, no nodules, no protrusions from the epidermis. We can really follow the epidermis here. It's right and really linear. And so we could be sure that there is nothing left.
Okay.
Okay, this is also another example. We can see here the first line of my margin mapping, and this is the second, the big one. We can see here the first line, the shadow, and this is the big second shadow. And here in between we can see some tumor islands, and also here and here. And if we move on to the healthy skin on the right side, there's nothing left, no typical structure, a nice epidermis. So here we can also see a nice epidermis, but this is crucial. So we also have to look for the texture and the structures, and in my opinion this one is clear.
So when you press the play button, it just scrolls through all of the images, doesn't it?
Yes. Okay. I think there's also something there.
And then you can use the slide at the bottom just to drag through.
To drag through, yes.
Okay.
And to evaluate, I think here, wait 1 second. This was not so easy because we have a scar and there is no real original tumor left. There are just some residuals. And if we look here, we can imagine that there's some tiny nodule. It was a very small basic carcinoma. We have the histology. It was a nodular superficial subtype basic carcinoma with a tumor thickness of 0.3 millimeters. And we can see some very tiny nodules here. And if we scroll through, we can also see one here. And there are a lot of blood vessels, of course. There's also the scar. And
Why does your pen mark shadow seem to disappear and then come back?
There is no pen mark.
Oh, there isn't. Oh, sorry.
This is just the center.
Yeah, yeah.
This is just the center, but here we have also one very nice nodule.
Okay.
This is how I measured it, where I measured it, the thickness. We have a very good correlation to the histology here, because there this nodule is 0.36 millimeters. And this was the central slide with the scar in the middle. But this is just in the center, and now we need to evaluate, the lateral margin.
Okay.
I mark now the scar because we just, know the scar. they did a primary closure.
Okay.
So you have this boat shape.
Oh yeah.
And then normally in the upper and in the lower part there is no tumor. So it's just, for closure up.
Okay.
So the tumor is just in the center. This is why I will mark it just in the center. Okay. And here we have also the demarcation of the pen, and here we have the shadow of the pen.
So this is starting the
This is starting the scan at 12 o'clock.
Okay.
And we could imagine that this might be a nodule, but I'm not 100% sure. And here in this field, this is healthy skin. We just see a lot of blood vessels here, the dark structures here, and also here the longish ones. But we don't see some tumor cells or protrusions from the epidermis. And then we go on to the next image. Here it is the same. We have here the pen in the middle, here is the shadow, here's the hyperreflection of the pen, and here we have inside the tumor. We could imagine that this might be a structure, or this one, tumor island, but here I'm not 100% sure. It's not so easy to interpret, but this big one is a blood vessel. We also had the blood flow visible when we had dynamic flow on, so it was clear that this is a big blood vessel. And this is the healthy side on the left. And now we go on. Now I turn the probe upside down it's better for the mapping around. You just need to know that inside the tumor is now on the left side, and on the right side is the healthy tissue. And here we also have again the shadow of the pen. And here is the inside the tumor, and this should be healthy skin. Here I was also not 100% sure. Maybe this could be a structure, or here, but I was not so sure, and this is why I did another take. I turned again upside down, and here I was sure this is again a structure of the tumor. This is a big blood vessel, a serpiginous one, but this one is a nodule. And here you can see the demarcation of the pen and the shadow, and here is the healthy tissue. Here is inside the tumor, here is the shadow of the pen, and this is outside and should be healthy skin, but it isn't. And this is why I added a safety margin. Okay, and now we see what I meant with it's not only nodular, it's also superficial, because here we have inside the tumor on the right side and outside of the tumor on the left side. Here we can see this very nice superficial protrusion of the tumor cells inside the tumor. Then we have the pen, the demarcation of the pen, but we can also see that there's a demarcation outside the tumor. And this is why there needs to be a correction of the margin, because here we can also see some superficial tumor cells. And then I expanded the original margin 2 to 3 millimeters to add the safety margin and to, include this tumor island. And yeah, then we go on. I moved it clockwise from 12 to 3 o'clock, and then I found this tumor island. And now we'll go from 3 to 6 o'clock and see if we find something there. Here we have the silver line margin with a pen. Okay. Here we have the shadow of this hyperreflecting pen, here right in the center. And on this side we have the normal tumor. Okay, here's the scar, if we imagine it. And here we have some superficial BCC rest. Okay, and you can see also this kind of structure over here. This line with a darker rim. So we see here is the superficial BCC also visible, and this means normally this should be healthy skin. But we don't have healthy skin here, we have PCC rest, so we need to expand the margin here also, okay?
So you're adding 2 millimeters?
Yes, I'm adding 2 millimeters. And when we saw it on the picture, it's between 9 and 12 o'clock. And here we have a very nice example, because here on the clinical image we have the first drawing with the pen and the second. And here we have the first shadow of the pen, and here's the second shadow. And we can see here, there's still a superficial tumor. It should be, because this is tumor side. And in between the two lines we can also see that there's a protrusion. And so we can understand that this was right to add another safety margin, because this, if we have cut here, this tumor would have been outside, and so there would still be a tumor rest. And this, on this left side, here we can see the healthy tissue, and here is no tumor rest visible. I redraw the margin I marked before with the OCT.